Well, my morning routine starts with getting up, and the very first thing I do is put the kettle on, and the next thing I do is make a pot of tea with leaf tea, and then it's ready to drink, and then I drink the whole pot, the whole lot, every bit of it. That's how I don't know how I'd survive without the morning pot of tea. I was born in Blackpool to working class parents. My father was a welder, my mother was at home. Things I did as a child was to do chemistry experiments in the kitchen, which was probably quite hazardous, but my mother tolerated it, provided the kitchen door was always open. Nobody in my family had gone to higher education of any sort. So the mere idea that I would want to go to university, let alone do something, you know, very special like become a doctor, was a step too far. I was allowed to say I wanted to be a nurse, but I wasn't allowed to say I wanted to be a doctor. And I got quite cross about that because I knew what I wanted to be. I remember the day that I qualified as a doctor, my father made a board with my name on it, and he wouldn't paint the letters on it until I'd actually rung to say I'd passed the exam. And he made this, you know, doctor label for my desk or my whatever it was, and that was wonderful. And from then on, of course, they were just very proud of the fact that I was doing something very special. But they were always very supportive, and you know, my mother particularly would give me a lot of help, even though she hadn't got the education herself. But she knew what was needed. She had the brain. She just hadn't had the opportunity, and I got the opportunity. I didn't become a purely vascular surgeon until 1982. I remained a general surgeon, taking out bowels and gallbladders and stomachs and stuff right through until I became a consultant at St Mary's. Undoubtedly some moments when patients would be very surprised to find that their surgeon was female. One of the stories that I tell in my book is about the man sitting opposite to me with an aortic aneurysm and me explaining to him what was wrong with him and what was needed, and he said, "Fine, yes, I understand that. Who's going to do the operation?" So I said I was going to do it, and his response was, "Bloody hell, a woman," with shock in his face. But you know, we became good friends. I said, "Well, I am a fully trained surgeon. I will be doing the operation." And oh, okay. And there were occasionally the other side of that coin was that people would say, if you have managed to succeed, then you must be good. There were certain bits of the profession where women seemed not to be attracted, and surgery was definitely one of those. I then set up this group called Women in Surgical Training. Initially, that's what we called it, Women in Surgical Training. It became Women in Surgery later, and it just grew, and the organisation has continued to this present day with its mantra, lift as you climb, which I think is absolutely wonderful. That's really the most important aspect of it, is that you turn round and help the person below you on the ladder to come upwards. I cannot see why it should be, on any grounds other than your ability, should you be prevented from taking on a role. There you are. You can clap me if you like.